Today's video is brought to you by BHEDesigns.com. If you want one of these beautiful American-made wooden flags that are right behind me or one of your own, visit their link in the description box below. How's everybody doing? My name is Anthony Brian Logan, and today we got to talk about Dr. Fauci saying that the pandemic, whatever you want to call it, has revealed undeniable racism right here in America. Now, there was so much that he said, I'm not even really sure where to begin. If you want to see his full comments without my commentary, I'll link to it in the box. But we got to go ahead and roll it right now. And at certain points, as we're watching it, I'm going to just give you my 2 cents right there because I can't even wait until after it's done. After we get done watching that, I'll talk more about what he said. Then I'll give you the rest of my 2 cents, my deep detail analysis, and then I'll wrap it on up with a nice bow on top. So without further ado, let's go ahead and roll it.
Not since the influenza pandemic of 1918 has humanity faced a public health crisis of this magnitude. Each of you deserves enormous respect for your extraordinary adaptability, resilience, and dedication to learning.
And let's pause right here for a minute. To give you some context, he was speaking to a graduating class of Emory University. So I'm not really sure how this was. Like, you got a virtual ceremony or whatever's going on, but this was the speech for that. And I could tell by his eye movements right now that he's reading. Nothing wrong with reading unless you did not write it yourself. And then if you didn't write it, who did and for what purpose? But we'll keep on going.
Completing your studies and graduating despite immense difficulties and uncertainties. COVID-19 has shown a bright light on our own society's failings.
Here we go. Get ready to cringe.
Our country's experience with COVID-19 has not only upended our own lives, but it has uncovered a stark reality and failing of our own society. The unacceptable disparities in health experienced by minority groups, especially African Americans, Hispanics, and Native Americans.
Okay, let's pause for a minute because before he even gets into it, I just want to say that he could be right about certain things about, different groups having different experiences. But the question is, why is that so? Is it because white man bad, orange man bad, racism? What's the actual reason? But he'll continue.
Many members of minority groups have a much greater risk of COVID-19, often because of the nature of the jobs that many of them have as essential workers in society. More importantly, when people of color get infected with SARS-CoV-2, they more likely will develop a severe consequence of the infection. And this is because minorities in general have a greater incidence and prevalence of underlying comorbid medical conditions, including hypertension, chronic lung disease, diabetes, and obesity.
That's true. But again, why? You're talking about, minorities have this, minorities have that. Now, is that a failure of society or just the way things are?
That lead to a multifold increase in hospitalizations and deaths from COVID-19 compared with the general population. Now, very few of these comorbidities have racial determinants. Almost relate to the social determinants of health, dating back to disadvantageous conditions that some people of color find themselves in from birth.
Let's pause. Okay. So what are we talking about here specifically? Like, if you are a so-called colored person of color, whatever you want to say, same thing, just a fancier version of saying the old term colored person. I mean, if you're born a certain way, why are you born a certain way? If you eat a certain way, why do you eat that way? You're talking about how bad things are, but you're not getting down to the core of what's really happening. You're alluding to a thing that you've not really been able to address thus far in the speech. But let's see if he'll be able to do it in the last 30 seconds he has on this clip.
Regarding the availability of an adequate diet, access to health care, and the undeniable effects of racism in our society.
Okay, now, lack of access to an adequate diet. How hard is it to eat properly? How hard is it? People talk about food deserts. What do you need to really eat? Because here's one thing. A lot of people all over the country, they get boxes from Amazon all the time. In the hood, projects, whatever. Boxes at Amazon. You got cell phones, you got Jordans. Surely you're able to buy, I don't know, a can of beans, some rice. Like when I was on next to no money, I'm talking about I got $20 US to last for the whole week to eat. $20 is all I got. I'm able to eat very well on that if I know how to spend my money. How hard is it to learn? You got libraries for free. You got many times free internet. You got your cell phone. You on your cell phone on TikTok, learning the latest dances. You're on Warsaw looking at fights. You're doing things like that, but you can't research how to get a good diet. You know, people develop diabetes and things like that. That's not a birth, thing. They develop things like that later because they live to eat. They're not eating to live. They enjoy all the bad food. They don't want to eat the good food. So is that racism or just a personal choice? It's a lifestyle decision. Okay. You didn't touch on the drugs and the alcohol too. That doesn't make it any better.
Let us promise ourselves that our corporate memory of this tragic reality, that an infectious disease disparately hospitalizes and kills people of color, does not fade after we return to some form of normality. Righting this wrong will take a decades-long commitment. I strongly urge you to be part of that commitment.
How you gonna do that? How you gonna right the wrong? What is the wrong? What's the wrong? Like the way you're talking about it, and whoever wrote this speech is kind of clever. They're not making direct accusations at a specific person or a specific institution necessarily. They're talking about healthcare, but they're not really getting down to the core. Righting the wrong, what wrong needs to be righted? You're going to tell somebody, but you're going to force people to eat a certain way, to live a certain way, to not, snort drugs and drink liquor. You're going to force them to do that because that's what it's going to take. So how are you going to actually right that wrong, Mr. Fauci? All right, so you saw that, you heard that. Now, Dr. Fauci, boy, oh boy, there was so much there. Basically what I saw was, the reason why so many people of color, coloreds, whatever you want to say, get hospitalized with the virus more than their white counterparts is because of racism. But racism, what does it got to do with someone's personal choices in their diet? You want to eat hog maws and fried chicken and bacon grease every day, 3 times a day, washing it down with a Mountain Dew, with a cold soda pop. You want to do all of that. Then you get to be 800 pounds in the bed. You catch the virus and you mess around and pass away. How is that racism? That's someone's personal choice or how they were raised. And if you're raised a certain way by mother, father, both, whatever it is, and then you come out a certain way that's not right, you kind of an antisocial type person. I mean, is that, whose fault is that? Is that the fault of this mythological thing called racism? No, it's not. No, it's not at all. And who appointed Fauci to be this kind of patron saint of the virus? I think the only reason why Anthony Fauci has so much airtime and why he's so popular among the left is because he was seen as a mole in the Trump administration. He was always the kind of guy that would go against Trump and kind of battle him publicly. And the left, they like that stuff. But Fauci himself has been wrong over and over again. What did he say from the beginning? And I'm going to keep saying it because it's got to be known. Maybe somebody's not heard it yet. I'm going to make sure you hear it. From the very beginning, and I'll link to my source in the box, Fauci said, there's no point in wearing the mask for the general public. If you are not sick, you're healthy, ain't no point in wearing the mask. It might block a droplet or two, but it will not provide perfect protection as you think it does. It'll make you feel better in the crowd, but it will not give you perfect protection. That's what he said. Then, like 2 weeks later, he says, okay, wear a mask. Then eventually, later on down the road, he said, wear 2 masks. Now, if you got the vax, no mask. They keep changing their stance. They keep being wrong. They keep just saying and doing things that are inaccurate, just, false. Then they come back and say, well, trust the science, believe the science. Well, the science keep changing, so what am I to trust? Whatever you say from day to day, you could say one thing one day and another thing a different day. I got to trust both, just whatever you do. I'm not some kind of puppy dog being led by a carrot, as Lena Wen, the so-called scientist from China, would say. I'm not going to be that. And I'm not going to allow you to just lead me by this whole carrot of racism. Oh, it's the white man's fault. It's racist. That's the reason why you 800 pounds and you caught the virus and you died. It's because of racism. Give me a break, please. As I close, I want to say this. I think what this pandemic has taught us is that you need to be in control of your health. Have your own personal agency be your top priority. Don't rely upon others to tell you how to live and how to eat and how to do all that kind of stuff. Okay, if you're a kid, you got parents. The parents need to be in charge. And if you're a parent, you need to be aware of what's going on. You need to be educated about what's happening and not relying upon the television and people like Fauci to tell you how to operate your everyday life. All right, do your own research. Everybody has a phone. Everybody got the internet. You're able to find out what's going on, find out what to eat. Having a balanced diet, greens, meats, no fried stuff is easy. Okay, don't be a 400-pound bump on a log. Be healthy, be productive, and be active. But I think I'll leave that right there for now. And what say you? Do you think that Fauci was correct about the planned pandemic revealing racism in society? If that's your viewpoint, let me know why in the comments below. Or was he wrong? People's habits in their life is not a thing that's determined by racism. People talking about food deserts and lack of access to proper meals. Please, like I said, you could buy food on Amazon, have it shipped straight to your house. So I don't want to hear nothing. You got all these Amazon boxes littering the hood. People got iPhones and Jordans and all kind of stuff. Surely you're able to buy a can of beans on Amazon or on Walmart, have it shipped to your crib, and some rice and stuff like that. How hard can boiling water be? I'm just trying to figure out what's happening. What I'm trying to say, racism is the reason why the scandemic blew out of control among the so-called people of color. But whatever your thoughts are, please let me know in the comments below. And that's all I got to say for this video. If you like what you heard, please comment, rate, share, and subscribe. Peace.